are going to talk about bioterrorism and transmission and dissemination of microbes and the pathogenesis of infectious diseases. And at last, we are going to talk about some inflammatory responses to infections and the morphological changes. First, let's talk about epidemiology, general epidemiology of infectious diseases. As you know, infectious disease, is important health problem worldwide. What common infectious disorders are you familiar with?
Tuberculosis.
Tuberculosis in some parts of the world. We have cases in Iran, and they are mostly seen in immunodeficient patients. And do we have vaccination for tuberculosis?
Yes.
What is the name of the vaccine? BCG. You call it
BCG.
And what are more common infectious disorders? For example, common cold, diarrhea, influenza, and for example, 2 or 3 years ago, COVID, it was a newly emerging infectious disease. And the epidemiology of infectious disorders are different in different parts of the world. As Robin said, influenza and pneumonia are the 8th leading cause of death in the US. In developing countries, for example, lower respiratory tract infections, HIV/AIDS, and diarrheal disorders are common. And in some parts of the world, malaria and tuberculosis are common. Okay. For example, do we have malaria in Iran?
Yes.
We have malaria in Sistan, Balochistan, and in south of Iran. We have malaria. And which patients are, who is more prone to infectious disorders? Children or
immunocompromised patients.
And patients who have some kind of immunodeficiency, for example, AIDS, or patients who are receiving chemotherapy, or patients who are receiving immunosuppressive medications because they have transplant. And these are the patients, or these are people who are more at risk for infectious diseases. Okay. What are the infectious agents? In this table, you see classes of human pathogens. As you see here, they are categorized based on their size. Here. The smallest one are parents.
Hanam pointer.
Okay. The smallest one, parents. And we also have viruses, bacteria, fungi, protozoa, and kelps. As you see here, bacteriums and viruses are intracellular. And bacteria can be obligated intracellular or facultative intracellular or extracellular. But fungi are extracellular or facultative intracellular. leishmania, and sometimes they are facultative intracellular or extracellular, and helminths are also extracellular or intracellular. For example, Trichinella is intracellular. Okay, what do you know about perions?
It's just a protein. It doesn't have any nucleic acid.
Yeah,
It's a protein.
just a piece of protein. And why do we call it abnormal form of protein? What is the problem with this protein?
No proper folded protein.
Yeah, it is a kind of misfolded protein, and that's why it causes disorders. And what diseases do you know about that are caused by perions?
Mad cow
Yeah, mad cow disease. Yeah. The perion agents can cause transmissible spongiform encephalopathies, okay, such as Creutzfeldt-Jakob disease, bovine spongiform encephalopathy or mad cow disease, and variant Creutzfeldt-Jakob disease. And all of these disorders are encephalopathies. Okay. For example, do you know anything about who is associated with human cannibalism? What does it mean?
Human eats other human.
Yeah, exactly. When a human eats another human, and if that human is infected with perions, we will see food in the patient. And other disorders, for example, Creutzfeldt-Jakob disease, mad cow disease, they are caused by perions. And do you normally have perion protein in neurons? We have it, but then a kind of misfolding occurs in it, it will cause the disease. For example, in this picture you see different structures of proteins. Here you see that, proteins are not only a chain of amino acids, they have different structures and different folding. And the folding is important because these folded proteins cause different diseases. Okay. And here we see the chain of amino acids. It's the primary structure. Okay. And here we have secondary structure, tertiary structure, and quaternary structure. These are all the two foldings of proteins. Okay. And here we see the normal perion protein. And this one, what's the difference between them? The misfolding. Yeah. So misfolding of proteins, misfolding of perion protein causes these encephalopathies. Okay? So the problem is with the misfolding. The next microbial agent are viruses. As you know, viruses are obligate intracellular parasites. Why are they obligate intracellular?
Because they use the host to
Document, yeah.
life cycle.
Because they need they need the host genome, they integrate into the host genome, and they proliferate, and that's why they are obligately intracellular. The structure of the virus, it has a nucleic acid genome, and it is surrounded by a protein coat which is called capsid, and sometimes it is encased in a lipid membrane which is called an envelope. Yeah? Here you see the structure. What's this part? We had
Capsid.
HIV virus. We talked about HIV virus yesterday. It had some glycoproteins on it. Do you remember? GP 41, 100. So here we have the protein capsid. Here we have the genetic material. The genetic material is either
DNA, RNA.
RNA or DNA. And in some viruses we have envelope.
Lipid membrane.
Yeah, we have envelope in some viruses. And different types of viruses are classified by, for example, the type of their genome. For example, DNA virus, RNA virus, sometimes by the shape of the capsid, sometimes by presence or absence of a lipid envelope, and the preferred cell type for replication called tropism. What is tropism?
Movement towards sun.
Each virus refers to proliferate in a special type of cells. For example, for example, HPV prefers epithelial cells. Or for example, rhinoviruses prefer cells of upper respiratory tract. This is called tropism. And sometimes they may be classified by the type of pathology they cause. And yesterday we talked about CMV. Can we detect viruses in light microscopy examination? No. Can you diagnose some viral diseases by examining the slides with light microscope?
Yes.
Yes. Such as CMV. Because some viruses make inclusions or changes which are, which we can diagnose in examining the slides with light microscope. As I said, because some viral components and particles aggregate in the infected cells and form inclusion bodies, we can detect them by light microscope and we can diagnose them. The most famous one is CMV, which we said has inclusions both in the nuclei and in the cytoplasm, but the nuclear inclusion is more characteristic and it resembles
Owls.
exactly. And also herpes viruses form large nuclear inclusions and other changes which are detectable by light microscopy, and also smallpox, rabies, and but most viruses are not detectable and they do not make changes that we can detect by examining the slides with light microscope. Here you see the picture of a virus and it is taken with electron microscope. Here are some changes in the cells and you can detect them with light microscope. For example, what is this one? CMV. And here you see the nuclear inclusion and there are some smaller inclusions in the cytoplasm. Also in this picture you see smaller inclusions in the cytoplasm. And what you see here, this is a large cell. And it has multiple nuclei. And you see that there is molding of nuclear membranes. This is herpes simplex virus cytopathic effect. We have a giant cell, okay? A cell with multiple nuclei, okay? Or a polykaryocyte. It may also cause inclusions in nuclei and other changes, okay? But the most famous one is this polykaryocytes, okay? And this one you see that there is a ground glass appearance of hepatocytes, cytoplasms. Okay, this is HBV cytopathic effect. Okay, and these are some examples of light microscopic changes of viruses. We have also other viruses which cause cytopathic effects, but many of them do not have any signs in light microscopic examination.
Then can you repeat the last one?
That's one, yeah. This is the tissue taken from liver in a patient who has HBV hepatitis. Okay, HBV makes this change in the cytoplasm. You know, the virus cytopathic effect may be seen in nuclei or cytoplasm. Here we see that the cytoplasm of hepatocytes has a ground glass appearance, as you see here.
Gram plus.
Ground
Ground.
glass, yeah, ground glass.
Don't throw this one.
Ground glass. Do you know the meaning of ground glass appearance? Glassy.
Glassy appearance.
Yeah. And it has something, you know, a granular appearance, you know. And this is the change we can see in HBV hepatitis.
Cytoplasmic change.
In cytoplasm, yeah, not in nuclei. Here we had nuclear and cytoplasm changes. Here we had nuclear changes, and here we have cytoplasm changes. Okay, and you know, viruses can cause different diseases. Some diseases are transient. For example, common
Sure.
cold, many of the diarrheal diseases. But as you know, some viruses are not eliminated from the body, and sometimes they remain in the body and continue to multiply. You know, such as viral hepatitis agents, for example, HBV, HCV. They are in the liver and they are replicating. Okay, and sometimes they remain in the body but in latent form. They are not replicating, such as
Human simplex virus.
yeah, or because for example, herpes zoster virus, okay, or HSV also, HSV for example, the sores we see in lips or genital area, or herpes zoster virus. You have, you know, you have it in your body, and maybe after some kinds of immunosuppression or stress, you will have zona. For example, in childhood we have chickenpox, and after many years, after stress or immunosuppression, we will have zona. Okay. And sometimes viruses are able to transform a host cell to a tumor, yeah, because they are integrated in the genome and they make changes in the genome. For example, what changes? For example, they you know, activate oncogenes or suppress tumor suppressor. Yeah. For example, HPV, which is able to you know, produce benign tumor such as a wart. For example, a wart can be a benign lesion, a benign proliferating lesion. It is not a neoplasm, but it is a benign lesion. And sometimes a malignant tumor, such as
Hepatoma.
cervical, uterine cervix squamous cell carcinoma, or for example, anal squamous cell carcinoma, or adenocarcinomas of genital tract. Okay, and sometimes different species of viruses produce the same clinical picture. For example, adenovirus and rhinovirus both cause upper respiratory tract infections with the same symptoms. Okay? And sometimes one virus can cause different symptoms. For example, cytomegalovirus causes neurologic damage, gastroenteritis, and different symptoms. Here you see in this table different viruses causing diseases in different organ systems. And I think you know them. Yeah? For example, adenovirus, for example, it causes upper and lower respiratory tract infections, rhinovirus, influenza virus, and other types. And after that, bacteria. What kind of bacteria do you know? Can you name some important bacteria and the diseases they cause? Sorry?
Streptococcus,
Staphylococcus, streptococcus, and
Treponema.
bacteria are prokaryotes. Yeah? They have a cell membrane, but they lack membrane-bound nuclei and other membrane-enclosed organelles. They have a cell wall. Yeah?
Yes.
And the difference in their cell walls causes different staining with gram staining. Bacteria are either gram positive or gram negative. Gram positive bacteria have a thick
Thick cell wall.
They retain the crystabial stain, and the gram negative ones cannot. Here are the structures of these two types of bacteria. Gram-positive bacteria such as
Streptococcus.
and gram-negative bacteria such as
Neisseria.
Neisseria and enterobacteria such as Escherichia coli. And as you see here, gram-positive bacteria have a thick wall, and they retain crystabial stain, and they are gram-positive. And gram-negative bacteria have a thin wall. They have inner membrane, outer membrane, and they don't have much peptidoglycan in their walls, so they are gram-negative. And what are these kinds of bacteria?
Streptococcus.
They are cocci,
Cocci.
and they are gram.
Positive.
And how about these ones?
Bacillus.
Bacilli and gram
Gram-negative.
negative. Yeah. And some bacteria are round, they are cocci. Some are rod-shaped, they are bacilli. Some are something not completely rod, not completely.
Commercial.
Yeah, cocobacilli, and they have different shapes. And here again you see gram-positive and gram-negative bacteria. And some bacteria are motile and some are not. How do they move?
Flagella.
They move by flagella. And some bacteria are aerobic or anaerobic. What does it mean?
Fragmentation in presence of oxygen or not.
Yeah, exactly. And some bacteria have these structures. Pili. Yeah.
For conjugation.
They use it for
Conjugation.
attachment to
Transfer of genome or
Sex.
genome terms.
And both gram-positive and gram-negative bacteria have structures to attach to the host cell. For example, we have pilus for example, E. coli, which wants to attach to the mucosal cells of urinary tract and cause urinary tract infection. And for example, in gram-positive bacteria, we have some adherence proteins as well. And also, we should say that bacteria can be extracellular, as I said. Sometimes they are facultative intracellular, such as mycobacteria, and sometimes they are obligate intracellular, such as rickettsia. Why are they obligate intracellular? Because unlike viruses, they can make their genome, and they cannot. Why do they need the whole cell? Most of the times they take ATP
from metabolic activities.
ATP. Okay, we have, for example, obligate intracellular bacteria such as chlamydia and rickettsia. Can you name some diseases caused by chlamydia trachomatis? Paraform. Eye disease and it can
Chlamydia.
cause sterility.
Yes,
Infections of chlamydia trachomatis can cause female sterility, and sometimes they can cause blindness. And about rickettsia, it can cause Rocky Mountain spotted fever, dermatitis, and many of them have, are transmitted via some insects, lice, tick. And as you see here, rickettsia is transmitted by arthropod vectors, for example, lice, ticks, and mites. And how about mycoplasma? Can you name disorders caused by mycoplasma? The most important ones is mycoplasma pneumonia. Can cause pneumonia. And mycoplasma does not have a cell wall. And it is the tiniest living organism. And in this table again you have different kinds of bacteria and different diseases they cause. Again, I think you know them. And it's Gramus. Can you describe this bacteria? Yeah, gram-positive cocci. And how about this one? Gram-negative, and it's a bit difficult, I think.
Nigeria?
Yeah, I think, no. I also thought it may be Neisseria, but it's rod, as the book says. It's a short rod. These are gram-negative bacilli. Yeah, but I also thought it's because it's very short. I thought it's good. This is silver stain.
Treponema pallidum.
Maybe treponema, but this one is Borrelia. But we cannot say by seeing this picture. It may be its shape is a spiral. We can only say that it has a spiral shape. It may be treponema, Borrelia. And fungi. What's the difference between fungi and bacteria?
Composition and
Yeah.
Yeah.
Yeah, exactly. What do you mean by eukaryote?
discrete
cell membrane.
Yeah,
Membrane born organism.
yeah, exactly. So fungi are eukaryotes, and have different structures in fungi and we have different kinds of fungi. Can you name some fungi?
Actinomyces.
Aspergillus, Candida albicans.
Actinomyces
It's bacterial, but
is
fungi.
but I think in your book it is categorized under bacteria.
In our, we study it in
Oh,
both in Panjayas.
नहीं दो exceptional इनमें
in your mycology
Bacteria.
class,
No, bacteria is bacteria.
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 And okay, one of the famous ones.
Candida albicans.
Aspergillus.
Aspergillosis.
Mucormycosis.
You saw the slides of mucor
Yeah.
and aspergillus. So we have different types of fungi and they have different forms. For example, yeast cells or hypha, and the hypha may be septate or aseptate. For example, in this picture we have yeasts. We have yeasts, and they are unicellular. Here they show the budding of a yeast. Okay, and here are
Septate.
which are septate or aseptate,
Aseptate.
or sometimes pauciseptate. And the slides you saw, for example, mucor is aseptate
Aseptate.
most of the times, and aspergillus is
Septate.
And fungi cause different kinds of infections. For example, superficial infections, subcutaneous infections, deep infections. For example, some fungi only involve skin, hair, and nails because they like to live in, keratin. They are keratinophilic. For example, dermatophyte. Or sometimes they are subcutaneous. They invade the subcutaneous tissue and form abscess or granuloma. For example, mycelium. And sometimes they cause deep infections, especially in immunosuppressed patients. For example, aspergillus, dimorphic fungi. What are dimorphic fungi?
It can exist
To
in two forms.
in yeast and mold.
Yeast and both in that.
At
Different
what
temperature.
temperature they are yeast?
Additional
Room temperature, they are
They are mold. And
At body temperature, they are yeast.
They are yeast, exactly. And many times fungi are opportunistic. For example, in patients who are immunosuppressed. For example, we have some kinds of fungi on our body. For example, on our skin, we may have candida or on mucosa. But for example, when a patient is immunosuppressed, they will have candidial esophagitis, for example, or infections of lower GI tract by candida. But normally we can see yeast of candida in our stool. But if we are immunosuppressed, we may have infections by these kinds of fungi. And what do you see in this picture? It's a
Blood
vessel,
vessel.
and we have
Yeast,
mucor.
mucormycosis.
These are the thick aseptate hypha of mucor, and they have invaded a vessel, and that's why they cause necrosis. Do you remember when COVID-19 was common, some of the patients had mucormycosis, some corona patients, and they called it black fungus. And here we have protozoa. Protozoa are eukaryotes, but they are single cell, and they cause disorders in developing countries most of the time. And they may be intracellular, such as leishmanium or plasmodium, and sometimes they are extracellular. Many of them are extracellular. And some of them, for example, Telecomonas vaginalis, it's a sexually transmitted disorder. Or some of them cause GI problems, for example, entomopathica or GRD. And some of them are blood, for example, plasmodium, trypanosome, or leishmania. And also Toxoplasma gondii is, for example, by having contact with cats, or by eating undercooked meat, you may take this disease. And the last one, helminths. Helminths have complex life cycles and sexual reproduction and asexual multiplication. And there are different types of helminths. For example, three categories.
Cystodes, nematodes, and nematodes.
Exactly. Nematodes are round.
Round
We mean that their cross section is round, circular. And they are not segmented. They are not segmented. We have different types of nematodes. For example, we have intestinal nematodes such as Ascaris, Staphylococcus, hookworms, and we have sometimes tissue nematodes, for example, Buscheriaria bancrofti, Trichinella. For example, what do we see here? What is the tissue? What is the tissue?
Tissue.
The normal tissue here. Yeah, skeletal muscle. Yeah. And we have Trichinella. Trichinella spirals. And cestodes or tapeworms. They are segmented, and they have a head or a squelette and a ribbon of multiple flat segments or proglottids. We have different kinds of cestodes, for example, fish, beef, and pork tapeworms, and sometimes, we are the intermediate host of some cestodes. For example, in Echinococcus granulosus, or for example, in Echinococcus multilocularis, we have the slides of them and we are going to see them. And we have trematodes. Trematodes are leaf-shaped, some of them. Some of them are leaf-shaped, and they have suckers. And some of them, like schistosomas, you see that the female worm lives inside the male. Exactly. And we have some ectoparasites, such as
insects,
insects, mites,
lice.
and can you name some diseases caused by these ectoparasites?
Yersinia.
Yersinia.
Lyme disease.
Malaria, dengue. Malaria.
Leishmania.
Yellow
Disorders caused by rickettsia. I said many of them have vectors. And sometimes they live on our body, yes? such as
Lies. What?
lice, yeah. And sometimes they normally live on our body, for example, on our skin. Demodex mites. We have Demodex mites in our follicular-sebaceous units of skin. And sometimes they cause disease, for example, in rosacea. Yeah? And sometimes they cause disease by their bite. We have bite reactions of skin. So they can cause different kinds of